Hi, I'm Dr. Bertalan Meskó, the medical futurist, and today I want to explore how we screwed up the COVID-19 pandemic so badly.
No social distancing at U.S. airports as Americans returning from Europe are forced to wait hours to be screened for COVID-19.
Already, I talked about the many ways of how the pandemic can end, I covered what to expect from the second wave, and I talked about the conspiracy theories that captured way too many people's imagination. Conspiracy theories represented the thoughts and actions of an irrational minority, but even the slow and misguided actions of the rational majority further escalated and worsened the crisis. Let's see why. Six months have passed since the beginning of the pandemic, and with COVID-19 dominating our lives for the foreseeable future, it's paramount that we take a look back and see what we screwed up at the start of it. Because the only way to learn from our mistakes is to acknowledge them first. With that said, and it's hard to admit, but it was part of the scientific community that failed us miserably at first. In December, Taiwanese health authorities sent their medical teams to Wuhan and confirmed human-to-human transmission of the virus. They alerted the WHO, but as they are not part of the organization, this warning was not passed on to other countries. On January 4, Hong Kong health authorities announced that they suspected human-to-human transmission too. And on January 13, a woman who had never been at the seafood market got sick when she traveled to Thailand, strongly suggesting that the virus was already spreading within Wuhan. And there were many whistleblower doctors in Wuhan who were threatened with jail time. This was all already reported to and known by the WHO when a day later, on January 14, they tweeted that Chinese authorities found no clear evidence of human-to-human transmission of the virus. And this remained to be their official position even till late January. In those early days, the places that were able to contain the virus were Taiwan and Hong Kong that were actually defying the WHO's official position. They ramped up their domestic mass production, while WHO were insisting that they were ineffective. Taiwan even closed its borders, while the WHO insisted that travel bans were ineffective. And both Taiwan and Hong Kong screened travelers aggressively. If we understand the relationship of Taiwan and Hong Kong with mainland China, and know how influential China is in the WHO, we understand why the leaders of these two outliers in particular decided not to listen to the official positions. Hong Kong and Taiwan remember the cover-up of the SARS virus in 2003, when the world didn't learn about the new virus until it spread outside of China and we barely managed to control it. Back then, the WHO openly criticized China. This time around, they were parroting their cover-up and they were praising China for its transparency, while in reality, Beijing was trying their best to hold up information. What's disturbing is that the WHO had all the information to understand the depth and seriousness of the situation in time, and in retrospect, they could have put out the fire early on. When independent access was denied, the WHO had a chance to strong-arm China and alarm the world based on the numerous confirmations that human-to-human transmissions were taking place. They could have stepped up at the same time when Taiwan closed its borders and stopped the virus even before the first confirmed COVID death. But they didn't want to confront China and waited till January 22 to confirm human-to-human transmission, only after China did. And after that, the WHO also waited another 2 months up until more than 100 countries had reported cases and thousands of people died to finally declare a pandemic. Looking back, researchers estimate that with clear global guidance that the WHO was created for, and by acting even a week or two earlier, we could have reduced cases by 50 to 80%. This was our first mistake. But of course, China wasn't the only country trying to ignore what's needed to be done to keep the economy going and to save face. The UK had an infamously thoughtless and slow response at the early stages of the pandemic too. British Prime Minister Boris Johnson was already in the middle of one crisis with Brexit when the COVID pandemic hit, and he was not ready to shut down the economy. Experts thought the UK might try to aim for herd immunity like Sweden, but that wasn't exactly true. They were simply not up to the task. Lockdown measures were imposed too late, the testing and protective equipment were not widely available quickly enough, and they failed to protect the care homes. All that led to mounting case and death numbers, while the NHS was crumbling under the weight. Experts say if Johnson had introduced lockdown measures just a week earlier, death numbers could have been halved. In Brazil and the US, boy, anti-science politicians like Trump and Bolsonaro were the ones with the task of safekeeping their countries. They both downplayed the impact of the virus and opposed measures that could hit the economy. In return, the US and Brazil have the world's first and second highest case numbers, as the outbreak in these countries show no sign of slowing down. In Brazil, 2 health ministers had to leave their job after disagreeing with the president over the seriousness of the virus. Now the position has been filled by an army general with no experience in public health. As you do. In the US, Trump refused to wear masks for months, let Republican states go amok with their crisis response, and tried to blame even his own crisis management on China.
So with the masks, it's going to be really a voluntary thing.
He was fueling outright stupid and dangerous ideas like taking hydroxychloroquine or injecting disinfectant into the lungs as a treatment.
Supposing we hit the body, tremendous, whether it's ultraviolet or just very powerful light, and then I see the disinfectant where it knocks it out in a minute, 1 minute, and is there a way we can do something like that?
And don't forget that it was the Trump administration and John Bolton in particular that disbanded the Pandemic Preparedness Unit in 2018 as they burned down everything that was tied to the previous administration.
You have to go by where, look, here is the United States. Okay. Now look, we're last, meaning we're first.
Last? I don't know what we're first in.
Bad leadership was our second mistake. And all this misinformation, ignorance and a general lack of guidance spilled over to how individuals and how we as a society responded to this crisis. We have failed to acknowledge the gravity of the issue, since even our leaders and the scientific community had no agreement over it. In the US, irresponsible people have politicized the issue of wearing masks, which partially contributed to how the US became the world leader in case numbers.
I protest face coverings. I am a healthy American. I used to be free. I am not a terrorist. I am not Antifa. I am not a sex slave that wears masks.
Our own ignorance was the third mistake. As we faced even the simplest request to change our way of lives, many of us have failed miserably. Many of us are still not wearing masks, don't care about social distancing, and don't think globally. I mean, it's simply unbelievable how many of the people I know and the celebrities I follow are on vacations all over the world. If we are not ready to wear a mask in public and can give up on a vacation, how are we going to tackle global issues like climate change that will take a lot bigger sacrifice than that? Maybe because we couldn't and still cannot believe how serious a pandemic is and how long it takes to take one under control. I even received death threats as a response to my video back in April when I offered the possibility that the pandemic could last for years. I think this shows how much some of us are not ready to accept reality. Sadly, as a result, now we are just as vulnerable as we were during the first wave. And as we usually do, we are hoping that someone else will solve our problems and everything will be back to normal as soon as possible. In this case, we are all hoping for a vaccine. And while the race for a vaccine is unprecedented, it's not like we learned anything from what got us here in the first place. Namely, that there are countries that are still willing to put the health of their economy over the health of their people.
In the global race for a coronavirus vaccine, Russia said today it's already won, even though it hasn't completed phase 3 trials. That's not slowing Russia down, which today registered and approved for use its vaccine while continuing to conduct human trials.
Russia's decision to go forward with vaccinations without going through phase 3 trials has drawn a global outrage. Phase 3 trials involve giving thousands of people a vaccine or a placebo injection and then tracking them to see whether the vaccine prevents the disease. These tests allow researchers to confirm the vaccine's safety and look for rare side effects that might not have been shown in earlier trials. The Russian COVID vaccine has been tested on only 76 volunteers. If there is a side effect that takes place in only every 100 people that these tests have missed, then it could affect almost 1.5 million people if the entire population of Russia gets vaccinated with it. As you see, the stakes are high, but carelessness prevails when science gets politicized and the economy tanks. And if Russia does start to vaccinate in October, that puts enormous pressure on other countries to roll out their own vaccines as soon as possible. And if there is anything wrong with the Russian vaccine, then we will see the mainly American anti-vaxxer movement going global and we can wave goodbye to herd immunity. Obviously, there are levels of this crisis where we simply have no input. But we can do a lot more than most of us do now, and we have a lot more responsibility to stop this crisis than we acknowledge it. This is our world war. Even if we live in a country that managed to have some rest after the first wave, COVID hasn't gone anywhere yet. As a species, we are seeing a record number of cases almost every day that adds up to a mind-boggling million cases per week, and thousands are dying every single day. If you think I overreact, consider this. In the US, 3 times as many people died from COVID at the time of the making of this video than how many Americans died in the more than a decade-long Vietnam War. So, by going on vacations abroad, by not wearing masks, by forgetting about social distancing once in a while, by going out on the weekends for a drink without precautions, we are all undermining the efforts of the scientific and medical community to stop this pandemic. You and I can solve this by helping each other, by keeping the rules and accepting that for a bit, our lives are not going back to the way it was. For the next year or two, this is the new normal. Get used to it, live with it, wear your mask, and then we will get over it. Or fight it, protest against it, and we will live like this for a decade. If you want to hear more about COVID-19 and the future, please subscribe below.